Hello, I'm Tim Parry. I'm 33 and I was diagnosed with Tourette Syndrome aged 12. Today in this short documentary, I'll take you through a brief history of the condition, what you can expect from someone with Tourette's, known causes of TS, and what treatments and aid are available for sufferers here in the UK.
The Oxford English Dictionary defines Tourette syndrome as a neurological disorder which affects the brain and nervous system, characterised by involuntary tics and vocalisations, and often the compulsive utterance of obscenities.
The condition is named after Georges Gilles de la Tourette,
a French neurologist in the late 1800s, although this was not an officially recognised field of medicine at the time.
Tourette's often starts in childhood. In some, but not all cases, it's hereditary, passed down from a parent. It's also often associated with other conditions like attention deficit disorder or obsessive compulsive disorder.
For example,
the first time I saw her, everything in my head went quiet. All the tics, all the constantly refreshing images just disappeared. When you have obsessive compulsive disorder, you don't really get quiet moments. Even in bed, I'm thinking, they're locked the door yet, the washman's yet, the locked the door yet, the washman's yet. So when I saw her, the only thing I could think about was the hairpin curve of her lips, or the eyelash on her cheek, the eyelash on her cheek, the eyelash on her cheek. I knew I had to talk to her.
Sufferers of Tourette's often experience what's known as tics. Tics can manifest themselves in both physical or vocal form and are categorized as complex or simple. For example, a simple physical tic could be a head twitch or blinking of the eyes. A simple vocal tic could be grunting or compulsively shouting out a word.
For example,
biscuit.
Take the biscuit.
Ah, biscuit, 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 biscuit.
Oh, it's cheating on you. Oh, it's cheating.
Due to these tics, sufferers of Tourette's often experience depression and anxiety,
resulting from embarrassment and low self-esteem. Tourette sufferers can also experience drowsiness due to their bodies constantly moving due to their tics and therefore burning more calories than the average person.
There is no proven cause for Tourette's. It is, however, known to be linked to the part of the brain that regulates movement, the basal ganglia.
It is thought that this part of the brain misfires, which results in the tic.
While medical science cannot fully explain what triggers Tourette's, there are, however, three main theories.
Genetics, as Tourette syndrome often runs in families. Plasticity, which is when the brain somehow manages to modify its own structure, resulting in the formation of new pathways and frameworks. And the most controversial theory, being infected at childhood by streptococcal bacteria, which is more commonly known as strep, and is a bacteria which causes a sore throat.
It is noted by doctors that after a throat infection, some children develop TS-like symptoms.
It is worth noting, however, that this theory is not recognised by all medical practitioners, and a research into this theory has been inconsistent at best.
Tourette sufferers are often diagnosed in childhood, and doctors first look to rule out other causes of the symptoms, such as problems with the patient's vision or an allergic reaction. Other conditions that can present tic-like symptoms include autism or dystonia, a condition which presents muscle spasms.
Brain imaging scans can also be used to rule out other abnormalities within the central nervous system.
Although there is no one single test for Tourette syndrome, a patient's medical team can make a diagnosis based on whether the patient started showing symptoms before the age of 18,
has symptoms not caused by another medical condition or medication, has had several tics and at least one vocal tic, and symptoms have been persistent for at least 1 year. There are a number of treatment options available for people with Tourette's. These fall into three categories. Treatments that do not involve medication. This could include behavioural therapy, which is designed to change the pattern of the patient's behaviour. Medication. For treatment of mild to moderate symptoms of Tourette syndrome, alpha-2 adrenic agonists are recommended. This type of medication stabilises chemicals in the brain and decreases the risks of the basal ganglia misfiring. Clonidine is widely prescribed in the UK, but like all drugs, can have some side effects. Common side effects of this drug include dizziness, nausea and vomiting, but these side effects usually dissipate when the patient gets used to the treatment. Muscle relaxants can also be prescribed for Tourette syndrome. The third option treatment for Tourette's is surgery and deep brain stimulation, or DBS. This course of action is seen as a last resort and is only recommended for extreme cases in adults. During the surgery, the part of the brain known as the limbic system is targeted, and the aim is to make a small break in the pathways responsible for the tics. In recent years, DBS has largely replaced this type of surgery. Deep brain stimulation involves implanting electrodes into the brain. The electrodes are then attached to small generators placed elsewhere in the body, and the generators then send a small electrical pulse to the electrodes, stimulating different parts of the brain, much in the way a pacemaker would regulate an irregular heartbeat. It's all fine and well reeling off a list of facts and figures about the condition, but in order to get a true picture of what it's like living with Tourette's, I decided to go and speak to my friend and amateur filmmaker, Spike, who's been diagnosed with Tourette's for most of his life.
Hey Spike.
Hey bro.
So, you're 29.
I am, yeah.
How old were you when you were diagnosed with Tourette's?
I was a lot younger actually. I was between 6 and 7 years old.
Okay, so you've been pretty much living with this your entire life.
As long as I can remember, literally.
Well, being diagnosed at such a young age, what was it like growing up with Tourette's?
It wasn't enjoyable. It wasn't great, if I'm honest with you. I mean, it wasn't all bad, obviously. Like, nothing's ever all bad, but it wasn't enjoyable. If I was to sum it up into one word, I'd say confusing.
Kids can be cruel, especially with things they don't understand, which I think is one of the core.
Yeah, very much so. And when you've got someone who looks relatively normal, doing abnormal things, it
sticks out.
Yeah, a little bit, yeah.
Obviously, being a sufferer of Tourette's myself, I understand that this can be a personal question, but if you don't mind, what kind of tics did and do you have? Vocal,
I
physical?
had hundreds, man. Like, I had hundreds, I really did.
Any copperalia, the swearing?
Obviously no, I never had copperalia per se. I did, however, have this thing. I was in, I can't remember what year I was in. I don't know, year 7, year 8 or something in senior school. I had to swear in every sentence that I said. For the most part, it was like I had to say fuck every time I said a sentence, but other than that, like, I've never had to walk down the street and shout obscenities before, no. I mean, I had, like, different tics. For the most part, like, there was, like, vocal tics and, like, I'd move my hands or something.
I noticed that you have one with your eyebrows.
I
have a few eye twitches.
My eyebrow one, like, I've had this, like, since early teens. Like, it's one that's never actually gone away.
I consider myself a heavy blinker.
Yeah, fair. There's also, again, another main tic that I've had since, like, I don't know, 16, something like that, is whenever I'm on a phone, like, I'll do this while I'm on it.
And your eyes flick up as well. And your eyes like look up,
yeah,
as you in sort of unison with you pulling the phone away from your ear.
Yeah,
that's one of the dead giveaways. What sort of treatment did you have growing up?
Not the best.
Medication,
not the best at all.
Or any sort of therapies, or
mostly medication. Like, is what I had from a doctor who had no idea what he was doing. For the most part, like, my treatment growing up ruined my life. Like, yeah, it's, every medication that I was on for Tourette's growing up had massive side effects for me. I mean, the first one, clonidine, I think it was. And bearing in mind, I was like 8 years old, right? I was coming home from school, going straight to bed without having anything to eat because of a bad-ass headache I had. Now, the doctors, when my mum told them this, like, said I was faking it. Are you kidding me? Like, an 8-year-old faking a headache?
That's ridiculous.
Christ, like, look, what was that about? Like, when I've just finished school.
Crazy.
Come on, really? And the second one, that was Pimicide. That wasn't a fun drug. It was an antipsychotic. Do they even prescribe antipsychotics for Tourette's? Are they supposed to do that? I don't know. But that one I'll never forget. Basically, what happened was they told me it would make me drowsy and fall asleep. Well, it did. They weren't lying about that. What they didn't tell me was it made my stomach expand. So much so that I used to come home from school and I used to stuff my face until I was full, and then directly after that I'd get drowsy and fall asleep. Do that for, like, I was in it for what, 3-4 years. at the end of it, I weighed like 20 odd stone.
Wow.
Yeah, like 19.5 to be exact.
Wow.
Yeah, yeah. Until there's one Christmas where my nan turned around to me, right, and she was like, I wonder if it's just your like tablets making you eat so much. And I was like, stop them. And for like, I stopped them for about a week, and then the following week after it got, like basically left my system, I couldn't eat. I couldn't eat at all, and this was a week over Christmas.
Oh, you missed your Christmas dinner.
I didn't eat Christmas dinner that year. That sucks. Like,
Ouch.
Ouch.
So,
Like, yeah, from there it was like space of 6 months. I basically lost all my weight, went from like 19.5 stone to about 10, 11 stone.
Yeah, much
12 maybe. But yeah.
Nice. So, are there any treatments that have worked for you?
The treatment that I'm receiving now actually worked for me, and they basically balance out my levels.
They kind of even you out.
Yeah, yeah.
Okay.
The main issue I've had with my Tourette's in the later years, see, when I hit my later teens, like my Tourette's basically died down a bit. Like I, for the most part, even forgot I had it, you know. And so I hit about 24, where it came back with a vengeance, like ticks, noises, and just like my anger went through the roof.
You were a touch on the volatile side, yeah?
Yeah, it's a tad. And I had to get it sorted. Like, if for any other reason, because my girlfriend, like, she deserved better.
Oh,
from
of
me.
course. I mean, situations like that can put a strain on any relationship, really, especially with like a close loved one and a partner.
No, yeah, very much so. And because of what happened to me previously in my past, I didn't want to go back on medications again. But I went to see a professor in London, and she...
At the National Hospital for Neurology and Neurosurgery.
Queensgate, London, I believe.
Queen Square,
London is the one. Yeah. And she prescribed me some antidepressants, which have completely balanced out my levels, and I'm
Coping
calm now, you know.
Nice.
Like I don't get angry. I mean, things still piss me off.
Oh, of course, but
yeah, but like I don't.
We're talking now, it's an emotional reaction rather than a complete chemical misfire.
Yeah, yeah.
final question for you then. What message would you give to someone currently struggling in their battle with Tourette's?
Most of all, to be honest, stay strong. Like, stay strong. If you're at the stage where you are coming to terms with it, if you're just starting to build an understanding of it, like, stay strong and you will see it through. You will get to the other side. And once that happens, once you actually get a grip, not necessarily get a handle on your Tourette's, but get a clear sort of path in your mind of what it is, what it does to you.
Sense of acceptance. Of this is part of who I am.
That there are many positives to having Tourette's.
Well, thank you very much for talking to us about this, man.
Cool. Pleasure, bro.
Cheers.
Get on.
But everyone is different. What works for some may not work for another. Many Tourette's patients, myself included, spend years searching for the right methods and treatment to cope. On behalf of myself and everyone else involved in making this documentary, thank you very much for your time, and we wish you good health.
There are many different forms of treatment. For any more information, please contact your GP to discuss different options. Furthermore, you can ask to be referred to the National Hospital for Neurology and Neurosurgery in Queen Square, London. There is also a local support group for Tourette sufferers here in Plymouth. The group meets the first Thursday of every month, and the carers group meets the third Thursday of every month. For more information or to get involved, call Helen Fellows on 01752 205 210.